So hello everyone, hope you're all doing well. So today we will be covering how to access the NHS and healthcare, and in this we will be covering how to access the NHS, what NHS is, and what to expect when you're attending any medical appointments. So, what is the NHS then? Well, the NHS stands for the National Health Service, and the NHS provides services to those who need medical treatment and can also help with contraception, family planning, healthy eating, and mental health. Now, your health will not affect your immigration status or affect what NHS services are available to you. So none of the people who work for the NHS, this includes doctors, nurses, interpreters, none of them will pass on any information about your health to any person or organisation outside of the NHS without your permission. Now, this is only in circumstances where your doctor may believe that you may be of harm to yourself or other people. So, as an asylum seeker, while your asylum claim is being processed, you can access services for free. These include GPs, the A&E accident and emergency services, 111 service, and mental health services. So, GPs. GPs, meaning general practitioners, are also known as family doctors, who will likely be the first doctor you visit when you access healthcare. You should register with a GP as soon as it's possible. So, GP registration. Now, anyone has the right to register with a GP surgery. You might be able to register with a GP surgery that's not in the area that you live, and proof of address or immigration status is not required. Now, you can visit a GP if it is not an emergency and you need to see a doctor or nurse about your mental health. Now, GPs are highly skilled doctors who are trained in all aspects of general medicine, for example, adult medicine, child medicine, and mental health. Practice nurses are qualified and registered nurses who usually run clinics for long-term conditions like diabetes, and GPs also provide services like vaccinations, antenatal care, so care for pregnant women and their unborn children, and advice on smoking and diet. Now, you won't be charged for the majority of GP services, and to register with a GP, you will need to fill in a couple of forms. You can ask the GP for help to fill in the form if you need it, and there are different ways to register. So the NHS Choices website has a list of GP surgeries in the UK, as you can see in the link here, and you can check online to see where your nearest surgery is and how you can register there. So you can register in these sort of ways. So online, by checking the GP surgery website to see if you can register online, downloading a GMS1 registration form from the gov.uk website, or picking up a registration form at the GP surgery. Can I be refused registration by a GP? Now, you shouldn't be refused registration as an asylum seeker because anyone can access the GP no matter what their immigration status is, but you can be refused registration if the GPs are not taking new patients, you live outside the practice boundary and they aren't accepting patients from outside of that boundary, you've been removed from that GP surgery register before, it's a long distance from your home and you need extra care, for example, home visits. So if you have problems registering with a GP, you can call the NHS England Customer Contact Centre on 0300 311 2233. Changing GPs. Now, you can change a GP if you need to. This could be because you've moved, because you've had problems with your current GP, or because you were moved from the patient list. Now, you should tell the GP if you change address or move out of the boundary area. GP appointments and booking process. Now, in order to get help from a GP, you'll need to make an appointment. Appointments can be booked or changed at your GP by phone, online. So you can find out more following the link as you can see here, or in person by going into the surgery and talking to the receptionist. You should call your GP if you need an urgent appointment. Now, if your surgery is closed, a recorded message will tell you who you should contact, or you can contact the 111 service. What to do at your GP appointment? So there are a few things that you can prepare in advance that will help you to get the most out of your time with your doctor. So if you need an interpreter, you must tell the receptionist when you make the appointment. Tell the staff which language you speak and they'll book an interpreter for you, or get an interpreter on the phone. Now you can ask to see a male or a female GP or nurse, and your GP surgery will do their best to be able to accommodate this for you. Now, if the GP thinks that you're too ill to come to the surgery, they might visit you at home. And it might be useful to make notes of things that you want to discuss so that you remember to inform your doctor about them. For example, any medication that you're on. And you can also take notes with you on the day to make sure you've discussed what you want to discuss. Now, don't be afraid to ask questions if you're unclear about anything. Let the professional explain it to you until you are sure that you understand it. You can take someone with you as support, which you can discuss with your surgery. Here are some examples of checklists of questions that you can ask at your appointment. For example, if you've had a blood test or a scan, you can say things like, what are these tests for? How and when will I get results? Who do I contact if I don't get the results? If you've received any treatment, so you can ask things like, are there any other forms of treatment? What do you recommend? Any side effects or risks? How long will I actually be on the treatment? How will I know if the treatment is working? How effective is it? What will happen if I don't have any treatment? Is there anything I should stop or avoid doing while I'm on treatment? Or is there anything I can do to help myself? Also, what next? What happens after your GP appointment? So for example, what happens next? Do I need to come back to see you? Who do I contact if things get worse? Where can I go for more information? Is there a support group or any other source of help for any health issue that you're experiencing? Another thing is please make sure you arrive on time for your appointment, or cancel it if you are unable to attend, as this can result in you being taken off the register or even fines. Changes to accessing healthcare due to the pandemic. So as you all may be aware, there have been a lot of changes to the way we access the GP to prevent the spread of COVID-19, but you can still get the help that you need, and it's important that you do so. You can contact your surgery by visiting either their website, using the NHS app, or calling them by phone. Now, you must only visit a GP surgery if you have been told to do so. Urgent services. So you can also get medical help for problems that can't wait by calling the NHS non-emergency number 111. Now, 111 should be used when you need urgent advice or medical help, but it's not life-threatening. The number is free to call and the service is available 24 hours a day. You'll be asked for some details, such as your name and address, and if you don't speak English, you'll need to either request an interpreter in English at the beginning of the call, or ask a friend or relative to make the call for you in order to ask for an interpreter. Now, in life-threatening cases, you should call 999 or go to the A&E. But 111 is also available if you need some urgent medical advice outside of GP working hours. You can contact the 111 service by calling 111 or online by visiting 111nhs.uk for people who are aged 5 or over only. Now, 111 is available 24 hours a day and 7 days a week. How does 111 work then? Well, you answer questions regarding your symptoms on the website or by speaking to a trained advisor on the phone if you've called, and you can ask for an interpreter if you need one. Now, depending on your circumstance, you can find out what local services can help you. You can get connected to a nurse, emergency dentist, pharmacy or a GP. You can get a face-to-face appointment if you need one. given an arrival time if you need to go to A&E, meaning you spend less time in A&E, told how to get any medication you need, or given some self-care advice. Now, if English isn't your first language, then you can still use the 111 service. And the NHS uses the interpretation service called the language line to support callers who can't speak English. This service can also be accessed when using the GP. Just let your GP surgery know that you require an interpreter for your appointments with your doctor. Walk-in centres or minor injury units. Now, you can go to a walk-in centre or a minor injury unit if you need urgent medical attention, but it's not a life-threatening situation. Conditions that can be treated at walk-in centres or minor injury units can include, for example, sprains and strains, suspected broken limbs, minor head injuries, cuts and grazes, bites and stings, minor scalds and burns, ear and throat infections, skin infections and rashes, eye problems, and emergency contraception. If you're not sure what to do, please call the NHS 111 service and they can ask questions to ensure you get the help that you need. Emergency services 999 and A&E. Now, 999 should be used if someone is seriously ill or injured and their life is at risk. If it is an extreme emergency, call 999 and ask for an ambulance to transport you to a hospital. This service is free of charge and should only be used in an emergency. If you're able to, you may also make your way to the A&E department. Do not use A&E for minor medical problems. Please call the 111 service instead. So, an A&E department, also known as an accident and emergency department, deals with genuine life-threatening emergencies, for example, loss of consciousness, acute confused state and fits that are not stopping, chest pains, difficulty breathing, severe bleeding that can't be stopped, severe allergic reactions, severe burns or scalds, stroke and major trauma such as a road traffic accident. Less severe injuries can be treated in urgent care centres or minor injury units. So, what happens at A&E? Now, A&E departments offer support 24 hours a day, 365 days a year. Step 1. So, you're likely going to be registered. If you arrive by ambulance, the ambulance crew will provide the relevant details to reception and hand you over to the clinical staff. If you're seriously ill, the staff will already know because the ambulance crew will have alerted them on the way in. If you're not in a life-threatening or serious condition, you'll be prioritised by the A&E hospital team along with other patients waiting to be seen. Arriving by ambulance does not necessarily mean you'll be seen sooner than if you walked into the A&E yourself. So if you go to A&E by yourself, you must register first. You'll be asked a few questions like your name and address, but also why you're visiting A&E. If you've been to the hospital before, the reception staff will also have access to your health records. Once registered, you'll be asked to wait until you're called for your assessment. Some hospitals have a separate children's A&E department where medical staff are specifically trained to deal with children's health issues. You may be asked to go straight to the children's area where your child can be registered and assessed. So, step 2, assessment and triage. Once you've registered, you'll generally be pre-assessed by a nurse or doctor before further actions are taken. This is called triage. The process is carried out on all patients attending A&E. Triage ensures people with the most serious conditions are seen first. Step 3. Treatment, transfer or discharge. What happens next depends on the results of your assessment. Sometimes further tests need to be arranged before action can be decided, and the waiting time target for patients in A&E is currently set to 4 hours from arrival to admission, transfer or discharge. However, this can vary due to the amount of urgencies that have arrived at one time. In some cases, you may be sent home and asked to arrange for a GP referral. or you may be given a prescription and sent home. Either way, the hospital will inform your GP that you have been to A&E. If your situation is more complicated, you may be seen by an A&E doctor or referred to a specialist unit. Next, we're going to look at HC2. So what is it? So although some treatment on the NHS is free, for example like prescriptions, dental treatments, sight tests, wigs and fabric supports are not free to everyone in some parts of the UK. A HC2 certificate issued by the NHS allows you to get help with your healthcare costs. As asylum seekers, you're eligible for help with healthcare costs. So, how to get a HC2 certificate? To get a HC2 certificate, if you're on Section 95 asylum support, then the Home Office will liaise with the NHS, who will send out a HC2. If you have not received this HC2 after 15 working days from grant of this support, or after your previous HC2 has expired, you can contact Migrant Help on the following number: 0808 8010 503. Now you need to ensure that your HC2 is valid before getting treatment, otherwise this may lead to the NHS contacting you, requesting the charges or issuing a fine. If you're on Section 98 support or are on Section 4 support, you'll need to apply for a HC2 using a HC1 form. The HC1 form can be downloaded and printed online via the NHS website, or it can be ordered via the NHS website to be sent to you. It can be completed online, and you can also get copies from the DWP and pharmacies. What you get with a HC2 certificate. With a HC2 form, as long as you go through the NHS and not the private healthcare system, you get free dental care, only essential dental services though, free prescriptions, free sight tests, free wigs and support, help with the cost of your glasses and contact lenses. If you're referred to hospital or other NHS premises for specialist NHS treatment or diagnostic tests by a doctor, dentist or another primary care health professional, you may be able to claim a refund of reasonable travel costs under the Healthcare Travel Costs Scheme. What if my HC2 certificate gets damaged or lost? If you're on Section 95 support, you can contact Migrant Help on 0808 8010 503 to report a lost or damaged HC2. If you're on Section 98 support or are on Section 4 support, you will need to contact the NHS directly and they'll be able to send it to you within 10 working days. You can contact the NHS either through their online form, via the website or by phone at the number 0300 330 1343. Lines are open from Monday to Friday, 8 a.m. to 6 p.m. and Saturday, 9 a.m. to 3 p.m. You can also contact them at the address, physical address, and you can see the address listed over here. So, prescriptions. Now, when you've seen a doctor who prescribes you medication for any health conditions you have, they will give you prescription which you can use to obtain medicine. Usually, prescriptions were given to you on paper. Then you could take it to your local pharmacy to collect your medication. However, most prescriptions are now electronic. As an asylum seeker, you shouldn't have to pay for your medication as long as you have a valid HC2 certificate. Electronic prescriptions. Most prescriptions are now signed, sent and processed electronically due to the pandemic. Now you have two choices. You can choose a pharmacy or dispenser to dispense all your prescriptions. When you get a prescription, it will be sent automatically to the dispenser you have chosen and you can collect your medicines without having to hand in a paper prescription. You can decide each time you are issued a prescription where you would like it to be dispensed, When issued a prescription, you will be given a paper copy that you can take to any pharmacy or other dispenser in England. The paper copy will contain a unique barcode that will be scanned to download your prescription from the secure NHS database. Paper prescriptions will continue in some circumstances, but almost all prescriptions will be processed electronically. You can change or cancel your choice of dispenser at any time. You just need to speak to your GP or your pharmacist before you order your next prescription, and you should allow time for the update to take place to avoid your prescription being sent to the wrong place. Repeat prescriptions. Now, you'll receive a repeat prescription if you have medication that you need to take regularly. Usually these are collected from your GP, but again, due to the coronavirus crisis, this could vary. So please call the GP reception and check how this would work at your local practice. You may be able to order a repeat prescription online, but please speak to your local GP for guidance. Mental health services. Mental health problems range from the worries we all experience as part of everyday life to serious long-term conditions. Anxiety, post-traumatic stress disorder, and depression are the most common problems. If you have been feeling depressed for more than a few weeks or your anxiety is affecting your daily life, then you should make an appointment to speak to your GP. Your GP will be able to provide information on what services are available in your area. Advice is also available on the NHS website to support you on your way to feeling better. If you're an adult with depression or anxiety, your local improving access to psychological therapy services may also allow you to refer yourself without seeing your GP. Now, it's useful to look on the NHS choices to see whether this is available and to see what is available in your area, as you can see on the link over here. Now, if you're dealing with a mental health crisis, you can look on the NHS choices for crisis services in your area. You can either contact the NHS 111 or you could go to your nearest hospital with an A&E department. Dental services. Regular checkups allow your dentist to see if you have any dental problems and help to keep your mouth healthy. Your dentist will suggest how frequently you should have your next checkup based on how good your oral health is. Dental surgeries provide both private care and care under the NHS. If you're not entitled to a HC2 certificate, you will have to pay for NHS dental care. The HC2 will only cover essential dental treatment under the NHS. How you can access this? Well, you can register at a dental surgery as an NHS patient, or you can find your nearest dental surgery at www.nhs.uk following this link that you can see here. Now, if you require urgent dental care, you can either call your dentist, call NHS 111, or in the case of an emergency, go to your nearest hospital with an A&E department. Coming to an end now. So, summary. A general practitioner, so your GP, is the first doctor you will usually visit when you access healthcare. You should register with the GP as soon as it's possible. If you're seriously ill or injured and your life is at risk, please call 999. If you urgently need medical advice but it's not a life-threatening situation, call NHS 111. As an asylum seeker, you're able to access NHS services including GPs, hospitals and maternity services without charge. Thank you very much for attending this briefing today, and we hope you have found it useful.